My name is Dr. Eva Quiroz, and I'm an infectious disease specialist who joined LewisGale Medical Center in Salem, Virginia in 2017. I was born in Staten Island, New York, and when I was about 4 years old, we moved to Colorado, to a very small town, and then eventually we moved to Ponce, Puerto Rico. My first language was English, and then I learned Spanish. My grandmother was ill with cancer, and so she died when I was 5 years old, and that was one of the reasons we moved to Puerto Rico. At the age of 5, I had a sense of a vocation in medicine. That was before my grandmother's diagnosis of cancer, and she had a family medicine book at home, and I used to browse through the book. I felt a sense of that this might be what I was called to do in life, to be a healer. And I read the story of a little girl with polio, and I would go over the pictures again and again, and I was interested in the healing process. When we moved to Puerto Rico, I went to a Catholic school, and I focused on my education, and then they had a program in science and medicine at Catholic University. I received a grant to attend Catholic University and their medical school, which was Ponce School of Medicine. When I finished and graduated from medical school in Puerto Rico in 1993, I moved to Tampa, Florida, and attended the University of South Florida College of Medicine, where I completed internship and residency in internal medicine and a fellowship in infectious disease in '98. Infectious disease is the most interesting field that I could imagine being part of, and it's because it's so intense and detailed oriented, and in terms of finding out what's causing, it's all in the history. When you get to talk to someone and then learn about the travel history, learn about their family and what they had been exposed to, and if that was causing illness or not. And we also work with transplant patients, the cardiac transplant program at Tampa General Hospital, the renal transplant program. We also did rotations in oncology, so we treated the immune compromise and what happened when the immune system breaks down, and then you're more prone to other types of infectious diseases such as fungal infections or tuberculosis that might reactivate after being immune compromised. So it was very comprehensive, and it included every field, so I thought that this was a perfect field for me. The next step, I went to a conference and I learned about the Epidemic Intelligence Service program at the Center for Disease Control. And the amazing thing is that story about polio when I was just a little 5-year-old, at that program I was able to participate in a polio eradication program. So I joined the Center for Disease Control, I applied for the fellowship, and then I joined active duty with United States Public Health Service. Part of the program is studying epidemics, and so I attended the National Center for Infectious Disease and was assigned to the viral gastroenteritis section. And our duty was to investigate outbreaks. There were different outbreak investigations in different locations, and then the opportunity to participate in polio eradication in Bangladesh. I love working with the communities. And one of my passions is being able to teach and being able to share with people and learn from them. That was the amazing thing with polio eradication, is that we went to the hard-to-reach areas in the communities, and that includes the orphanages, the brothels, the hard-to-reach slum areas, and then we would try to teach them about polio, about vaccination, about the National Immunization Days, and work together as a team. So I love that part of medicine. I was active duty at U.S. Public Health Service at the Center for Disease Control and Prevention from 1998 until 2000, and then I joined an infectious disease practice in Pensacola, Florida. We covered 3 hospitals, and it was a busy practice, and it was a very interesting time. Then I relocated to California, and I joined a practice, an infectious disease practice, which was a multi-specialty group in 2004, and I worked with them until 2006, and then I opened my own practice, and it was a hospital-based practice at one hospital. And I was working until 2016, until I joined another multi-specialty group. In 2017, I started interviewing in different practices in different locations in the United States, and I was told about this town in Virginia, Roanoke, Virginia, and a hospital called LewisGale Medical Center. And when I arrived, it felt so warm and the people were so welcoming. One of the main reasons I joined the infectious disease practice here at LewisGale is that I saw the caring and compassion of the physician. I was able to see their caring about the community, the desire to improve the programs, the desire to help people. So that heart of service to the community was one of the things that attracted me to LewisGale Medical Center. The other thing that I really enjoyed is that walking around the community and meeting with people and just talking to them either at a shop or at a boutique, they would say, LewisGale Medical Center is my hospital, and those are my physicians. And that made me feel happy to join the program here and proud to become part of this community. When I arrived in Roanoke at the airport, I saw the Blue Ridge Mountains, the greenery, beautiful nature. I felt that this would be the perfect place where you have access to the big city and you have access to events, but you also have the opportunity to have a personal retreat like every day and be able to enjoy nature. I enjoy reading and writing, and also being able to join community events and make friends and do things together. And then I feel that it's beautiful here. I believe that all of the experiences in life help us become the person that we are today. And I believe that being able to go from a city as New York to a small city in Colorado, to grow up in Puerto Rico in a very small community surrounded by nature, and being able to see the rainforest and the dry forest and be able to work with the community and see a different aspect, and then travel to Tampa and to Pensacola and to California here and abroad, Guatemala, Bangladesh. All of it helps me see people in a different way, learn about the communities, develop a passion to help. So I believe that I've been blessed, and it's been an honor to be able to serve and see different things. What I hope to bring here is that passion to serve and to love the community as well.